Northern Health is committed to providing team-based primary care where every family doctor and nurse practitioner has the opportunity to work with a healthcare team. Primary care is used to help patients and their families receive the care they need in a simple and accessible manner. When a family doctor or nurse practitioner has the opportunity to work closely with other healthcare professionals, patients and their families receive more support to help them achieve the best possible health and sense of well-being. In this work, we are partnering with the divisions of family practice across the North, as well as with the First Nations Health Authority and our Indigenous communities. Primary healthcare teams across Northern Health are made up of various healthcare professionals, such as primary care nurses, social workers, occupational therapists, physiotherapists, dietitians, and others.
Patient and family-centered care means that the patient is placed at the center of the care that we provide. We begin our services and our support by asking what matters most to that person.
I believe that the client knows himself the best and they become part of our team. It's important to have a clear understanding of who that person is so that we're able to implement the proper care plan for them.
We like to empower our patients to take control of their own health and wellness goals and to actually be very involved in their care so that they are educated and they are able to make health and lifestyle changes that are going to support their overall health and wellness. In primary care, we are able to involve several other professionals who have expertise in other areas.
When you're not the only person who has to think about a patient, you have more opportunity for collaboration, more opportunity for consideration, and more opportunity for planning. Your colleagues may have ideas that you didn't think about, and you may have ideas your colleagues didn't think about. So when you collaborate, the patient gets better care.
We really do rely on each other to get our day's work done. So when a patient comes into the clinic, typically they're not just coming in to see like one provider, they're not just coming in to see the GP or the NP or the wellness counselor. Often they're coming into the clinic and they're seeing multiple health professionals in that visit.
Clients feel more heard because they don't have to repeat their story to every provider that they have contact with. So it allows them to maximize their time with their providers.
It's made it way more streamlined, which has allowed care to be more coordinated, less duplicated, and less frustrating for the patient.
You're going to see fewer preventable errors. You're going to see better patient care. And at the end of the day, that's what we want. We want our patients to have the best care possible.
Working in a team-based setting, using all of our different skill sets and knowledge bases to tackle the same problem for patients is just so much better than the traditional siloed model that we've been using previously.
Clients that have existing relationships with one clinician and building on that is better for the client. And I think that that's because relationships are really important and that it also supports the colleague who's connected to that client so that they don't have to do everything.
Working with the team has been really fulfilling, both on a personal level and on a professional level. Fulfilling from the sense that I feel like I'm making more of a difference to individual patients because I have a lot more information to work on, and the relationship that I have with the rest of the team really allows me to get complex problems solved for patients.
You get to see people who come in with health problems, you get to see them get better, you get to see them move on with life, and you get to know people, you get to know a lot of different people, and it's just a way more of a positive than it is a negative, and that's something that I really love about my job.